Alright, before we start, I just want to point out that I handed out a little packet, and it's basically just the pictures right here to everybody in the audience so they can see it clearer. I spend a lot of time in hospitals, most of my time in hospitals. I spend my weekends in the radiology reading room. It's my job. I call radiology reports, and I spend certain weekdays in Florida Hospital as a patient care companion, sitting bedside of patients who need special care and attention. In the medical field, there's definitely a language that's all its own. And when you spend a lot of time in this little bubble, in this world with this language, you often forget that people outside of the medical field don't speak that language and don't really know what it's all about. A standout example of this is a patient that I was volunteering with who had an infection, a very serious infection, that spread all over her leg. And she had to have a very intensive skin graft, which is when they take healthy skin and transplant it onto the infected site. She had a really, really bad infection, had the skin graft, and I asked her what caused this. And it surprised me because she said, a bug. And I asked her to clarify, and she said, I don't know, it's just a bug. My doctor told me I got it at a different hospital. Curious, I asked her nurse what had caused it, and he told me it was MRSA. The acronym MRSA, M-R-S-A, it stands for methicillin-resistant Staphylococcus aureus. And though most people don't really know what that means, in the medical field you'd be hard-pressed to find anybody who doesn't know what it means. It's a dreaded infection which is caused by a specific strain of Staphylococcus aureus, which is a normal bacteria that's on normal humans, it's normal flora, which is on human skin and sometimes in our nasal passages. However, it's an opportunistic pathogen, which means that it sits on our skin and waits for an open point of entry, such as a cut or sore, and for your immune system to be low, to attack you, to get into your system and infect you. Whenever this infection occurs, you can go to the doctor and you'll be treated with penicillin, oxacillin, or methicillin. However, because this is a very intelligent bacteria, over time it's become resistant, which means it's able to withstand all these penicillin, methicillin, and oxacillin, and it doesn't go away easily. So, this makes the infection harder to treat, and it prolongs treatment, which is not good when time is of the essence with an infection such as this. Last year, the CDC quoted that 94,000 people became infected with methicillin-resistant Staphylococcus aureus, MRSA, 19,000 of which died from the infection. 86% were caused by healthcare-associated MRSA, which means that they acquired it in the healthcare setting or in a hospital, and only 14% were community-acquired, which means that they occurred in people that were seemingly healthy and had no cuts, bruises, or anything like that, and it just happened. So, in order to understand how a bacteria like this works, we must go to the basic level, which is the cellular level. Organisms can be classified as gram-positive or gram-negative. Staphylococcus aureus is classified as gram-positive. I have a diagram over here, my poster that's falling off. Gram-positive basically means that its cell wall consists of peptidoglycan, which is basically just a macromolecule, a large molecule, bound together, like this, in your package as well. That's the only difference, that's one of the main differences between gram-negative and gram-positive. So, the cell wall, which is what peptidoglycan makes up in gram-positive cells, it acts as a layer of protection and as structural support for the cell, and to protect the internal components of the cell. Beta-lactam drugs, which are what penicillin, oxacillin, and methicillin are, which do not work on MRSA bacteria, beta-lactam drugs are what those are, and they consist of carbon and nitrogen in a square shape. Where did I have it? I have a picture of it. Oh, no, I don't have a picture of it. In a square shape within the drug. These inhibit cell wall synthesis by binding to components of the cell and making the internal susceptible. So they bind to whatever makes up this peptidoglycan so that it's won't it won't completely form, and then it makes the internal part susceptible, which then leads to Staphylococcus aureus being susceptible to destruction. So then it won't multiply and it won't infect. However, because, like I said, it's a very intelligent organism, over the years it became resistant to methicillin, penicillin, oxacillin, therefore leading to the need to use vancomycin, which is the preferred drug to treat MRSA. Vancomycin is effective for MRSA, opposed to the other drugs, because it binds a different site than beta-lactams, the penicillin, oxacillin, and methicillin did. Vancomycin binds to the D-alanine site, which is amino acids, part of the cell, and they stop peptidoglycan elements N-acetylmuramic acid and N-acetylglucosamine, which probably mean nothing to you, but they're important components that make up peptidoglycans, which then make up the cell wall, the volley. So that's why they use vancomycin, and I'm sure over time, and we already have strains that are resistant to vancomycin already. Alright, so you have to imagine that while hospitals may seem clean, think of all the sick people that are there. It's impossible to keep sterile, and which basically means free of germs. So, doctors and nurses oftentimes have MRSA strains on them and innocently pass it on to people and patients in the hospital that don't know. So, why do you need to know this? To protect yourself. It's important to be very alert as possible to make sure that you're keeping that others around you in the healthcare field, and when you go into hospitals and healthcare settings, are keeping hygienic standards. It's very easy to prevent MRSA as long as you wear gloves, wash your hands, and and watch out for any symptoms of MRSA. So I hope I didn't scare you all away, but that's MRSA.